There are 5 days left to campaign before Election Day, and President Trump and Democratic nominee Joe Biden are not wasting any of that time. Biden had a virtual meeting with public health experts yesterday in his home state of Delaware, while Mr. Trump held rallies in Arizona, where he said this about the coronavirus.
And a safe vaccine is coming very quickly. You're going to have it momentarily. That eradicates the virus, and we're rounding the turn regardless. You know that.
That claim does not match up with the guidance of the president's own task force. Reportedly, it has warned governors of a, quote, unrelenting broad community spread in the upper Midwest, the Midwest, and the West that will require aggressive mitigation to control. The U.S. reported more than 78,000 new cases of the virus yesterday alone. The president's chief of staff, Mark Meadows, joins us now to talk about all of this. Mr. Meadows, thank you for being here. So we got a record case count. We got hospitalizations surging. We got hundreds of Americans dying every day. What is the president talking about when he says we're rounding the curve?
Well, we've been making great progress with regards to therapeutics, vaccines. I think the lead-in that you had there talked about the vaccines. We're extremely encouraged by the progress that two particular companies have been making as it relates to vaccines. Some 100 million vials of those vaccines we expect to be deployed within the next 60 days. And so as we look at that, we do believe that we're rounding the corner in terms of the approval. As you know, we've had since February and March really this coronavirus that's affecting every family around the globe, and yet we still have to make sure that we allow science and our medical experts to be able to come up with treatment to actually address it in a meaningful way. You know, we're seeing right now in Europe even a surge that's higher than what we're seeing here in America, and so those mitigation efforts that we're taking along with vaccines and therapeutics hopefully will allow us to return to normal in the coming months.
Well, I'm glad to hear you say hopefully, because that doesn't seem to be the message that the president is putting forward. And I'm curious, I want to just clarify what the White House's position is regard to the coronavirus. We're all hopeful for a vaccine. We're all hopeful for those therapeutics you mentioned. In the meantime, does the White House still want people to socially distance, wash their hands, and wear a mask?
Oh, without a doubt. I mean, I can tell you that I probably have used more Purell than any American here in the United States over the last 7 or 8 months, making sure that we socially distance, wear masks when you can't do that. If you're in those environments, obviously we continue to get tested. You know, we're testing a lot more people. We get a lot more cases that are asymptomatic.
Well,
that's the problem with this virus. That's the problem with this virus as we look at this, is sometimes we have a spread from asymptomatic people. So you could have no symptoms, I could have no symptoms, and yet we're spreading to loved ones or friends. And so as we look at it, that's why the therapeutics, if we
you're absolutely right,
critically important. But
well, the reason I want to jump in here is because I just want to clarify. I'm glad to hear you say that you're using Purell and that people should socially distance and wear a mask. That is not the example being set by the president. I believe it was Asa Hutchinson on Sunday on Face the Nation who said it's a little confusing for people. You know, the president himself, your office, the vice president's office, they are not following their own guidelines. Can you see how that's a problem for people?
Well, I can tell you that I'm following the guidelines, and a number of us are following the guidelines as you look at it. Obviously, a number of us continue to look at this particular environment, and it's an unusual environment that we have, and so as we try to make sure that we come into contact with other people, making sure that we socially distance as much as possible, wearing those masks when we can't, we strongly encourage that. I also, for all of you that are watching this morning, is if you can carry a little container of Purell. I mean, just think about it in a restaurant environment. You know, you're drinking from a drinking glass. Well, that drinking glass probably has been filled by a waiter or waitress that has touched every other glass. And so I'm hyper vigilant as we look at that. We don't think about the ways that we potentially can become infected.
But Mr. Meadows, I want to ask, with 13 states hitting record highs for coronavirus hospitalizations, the death toll on the rise again, what is the administration's strategy at this point to get us to the point when we have a virus? I mean, there was the head of a hospital system in Tulsa, Oklahoma, said 2 days ago, I just fear we are entering a very, very dark winter.
Well, I can tell you that when we look at that, it's obviously the therapeutics and vaccines, but we know what doesn't work. We know that long-term lockdowns and shutting down our economy and making sure that everybody just stays inside their house doesn't work. We've tried that. It didn't work. It didn't work in Europe, and we're seeing actually a greater outbreak because of that in Europe, where they locked everything down, and now that they're opening things up, they're actually over 100,000 cases in Europe. And so we know what doesn't work. So let's go ahead and try to learn from the past 7 or 8 months to make sure that we adjust to that. Listen, everybody wants to get back to a normal way of life. And when we look at that, you've got moms and dads that are tuned in right now. When are their kids going to be able to go back to school? Are they going to have to miss those weddings and funerals? We've got to find a way to do that. The president is working around the clock, 24/7. He's encouraged his entire staff. In fact, he's demanded his entire staff to do that. And I think that in the weeks to come, between November, December, we'll have some great announcements that will give the American people hope.
But in an editorial in the New England Journal of Medicine this month titled "Dying in a Leadership Vacuum," the board, in a unanimous editorial, for the first time signed by all editors, said that your administration has taken a crisis and turned it into a tragedy. What's your reaction to that?
Well, I would disagree with that. When you look at what we have, we look no further than the state of New York and the number of deaths that happened in New York City early on in this process, and how it spread, what happened, and slowing the spread was a critical part of our strategy. Not only flattening the curve, but making sure that people had hospital beds if they became infected. And you can look at the number of deaths in New York versus the number of deaths in other states. What we've been able to do is see that the death rate continue to go down, and we will not stop. One death is too many, but we're not going to stop. We're not going to stop until the death rate is less than that of a flu, and hopefully that vaccine will help us get there.
Yeah, Mr. Meadows, the dropping death rate is cold comfort if the case count is going up. You can ask a statistician about that one.
Well, I would strongly disagree with you. Is that obviously if the case count is going up and we're finding that the fatalities go down, where what we're experiencing is less than we.
Mr. Meadows, we are facing a 9/11 like fatality rate every few days here in this country still. So I think the American people are going to make a decision based on the record of your administration in controlling and containing the virus versus what the plan of the Biden administration would be. That's the choice before us. You've laid it out, and we appreciate it. It's very clear. It is a stark one.
There's no one that believes that one death is too many more than me or my wife or our family. Anytime that you lose a loved one, it's critical. It's important that we address that. The president has expressed that over and over and over again.
And yet the rallies continue. We've got to take a break here, Mr. Meadows. We've got to tuck one in. We would have you back again soon, though. Good luck in these final days on the campaign trail. Mark Meadows, thank you very much.